Clinical nurse specialists add huge value to urology departments across the country. However, effective succession planning for these roles is essential to maintain and develop future services. The Royal Wolverhampton NHS Trust believes that by focusing on forging rewarding careers for nurses, patients receive better outcomes in their long-term treatment plans. Selina Downes went to find out more.
At Wolverhampton's New Cross Hospital, urological surgeon Peter Cooke and his team are performing a robotic prostatectomy.
Slowly, 2 more inches.
It is fascinating to watch.
Keep going, and stop.
Several small incisions are made in the patient's abdomen, then instruments are inserted and attached to robotic arms. With the utmost precision, the surgeon controls the robot, sitting at a console with enhanced 3D vision. While at the operating table, a specialist urological nurse is performing equally critical work that the surgeon says is vital.
They set up the patient. During the course of the procedure, they will bring in sutures, they will bring in clips, they will suck. They are my hands and ears in the operating theatre, and you can't do this kind of surgery without a dedicated assistant.
The robotic surgery is only half the work.
Afternoon, Mrs. Beasley.
Patients need to be supported both before and after surgery, and this is stimulating new opportunities for urology nurses to enhance their own careers.
You having any issues at the moment? Any bleeding?
Yeah.
Jenny Akins has been a nurse for 21 years. In that time, she's completed a degree and a master's and has advanced her career to that of autonomous practitioner.
Generally, it's prostate and bladder cancer I deal with. I see patients from their GP, so I assess, make a diagnosis, initiate treatments, request investigations, and I'm able to prescribe. So I'm preventing any delays in that patient's journey. I have been very fortunate to be supported, and not by just the trust, but clinicians, by my managers, and they have encouraged me throughout my education, my development, which has enabled me to progress up to an advanced nurse practitioner.
And with ever-increasing demands on clinical nurse specialists, the British Association of Urological Nurses is there to provide support, education and development for the urology nurses of the future.
I think that if you're going to develop from a novice to expert in terms of being a specialist nurse, then you ultimately have to marry that up with educational structure. And most advanced nurse practitioners are degree level or master's level trained, and that gives you the insight to not just look at giving protocol-based care, but to actually look outside of that and to respond to unique situations.
Specialist nurses play a vital role in relieving some of the burden on clinical teams. Their education and experience is invaluable both to the hospitals they work with and the patients they care for.
It's the most exciting, stimulating area to work as a nurse. It offers immense opportunity for development of both your skills and your knowledge, and you can make a huge impact on the patient experience, which is ultimately the most rewarding.
Hello Robert, my name's Mandy.
Improving the patient experience is just one of the many challenges.
The purpose of this video chat is to go through everything about your surgery, so have a chat about what's going to happen before your operation and on the day that you're here and on the day of discharge.
The patient chats have moved online due to COVID-19, but they are no less comprehensive.
So Robert, this is where we're now going to talk about your catheter.
Designed to help put cancer patients more at ease before, during and after their treatment.
Junior Hemans.
Junior Hemans is just one of the many patients who say they've received first-rate care and support from the urology nurses at New Cross.
You can talk to them about anything and it's not deemed uncomfortable in terms of having that conversation because of their professionalism.
And it's that professionalism that aims to promote and maintain the highest standards of urological nursing and patient care now and for the future.